There's a lot of discussion about weight loss options these days, including surgery. Joining us right now to talk about weight loss surgery is Dr. Becca Karlsdotter, bariatric surgeon at Northern Light Surgical Weight Loss. Welcome, doctor. Thanks for joining us. Well, although folks should feel comfortable no matter their body size, why is obesity truly a health concern?
Well, there are a lot of serious health issues that accompany carrying excess weight. Things like type 2 diabetes, high blood pressure, sleep apnea, and all the way over to things like liver disease and certain cancers. And we know it's not just because of a number on a scale, it's because of hormonal and inflammatory effects that carrying that excess fatty tissue causes. And weight loss surgery is one of the things that can address all of those.
And doctor, help us understand the difference between being overweight and then having obesity.
Yeah, so the criteria we use to kind of discern that is called the BMI, or the body mass index. And it's a calculation we make based off a person's height and weight, and you can find online calculators to calculate your own. Overweight is considered a body mass index between 25 and 29.9, and anything over 30 is considered as having obesity. Bariatric surgery or weight loss surgery is considered in people who have a BMI greater than 35 or a BMI greater than 30, along with one of those medical conditions that we talked about.
Gotcha. Yeah. So it sounds like BMI is pretty key when it comes to determining if somebody's meeting the criteria for weight loss surgery. But what are some of the other ways that that might be measured, doctor?
So our patients typically have at least 70 to 100 pounds to lose. They've often had multiple attempts at weight loss, sometimes even with success, but just not been able to achieve that long-term durable weight loss results. And overall, they're ready to make a big change towards better overall lifetime health.
And if somebody's watching this and maybe meets those measurements and they are interested in weight loss surgery, what would happen next? How would that work?
Yeah, so a great way to start is to watch a 20-minute information video on our website. It goes over our comprehensive program. It's not just surgery. Surgery is a tool in our toolbox, but we have dietitians, we have psychologists, we have a nurse practitioner, we have a big support system along with peer support, so that you're supported both before, during, and after surgery. And those are the main things that you can do, as well as talking with your primary care physician about it.
And doctor, what kind of surgery is available for somebody who is interested?
Yeah, so here at Northern Light Health, we typically do two types of procedures for obesity. The gastric sleeve, which is the most common operation for obesity in the United States today. That's where we remove about 80% of the stomach and leave a long, skinny stomach, kind of shaped like a banana. And then the other one is called the gastric bypass, where we create a small stomach pouch. We leave the rest of the stomach in, but bypass that and the first part of the small intestine. And they both work because we're making the stomach smaller, but also because we're bypassing or removing a part of the stomach that creates a lot of the hunger hormones and controls satiety signals. We do these surgeries in a minimally invasive robotic fashion, so small incisions with less pain and quicker return to activities. Our patients, the same day of surgery, can start sipping on liquids and moving around, and typically go home the morning following surgery.
So some really helpful info there. Where should folks go to learn more about the program, doctor?
Yeah, so our website, northernlighthealth.org/SWL for surgical weight loss, or they can call our office at 207-973-6383. All
right, Dr. Becca Karlsdotter with Northern Light Surgical Weight Loss. Really appreciate your time and, of course, your insight. Have a great day. Other news we're following. Thank you, doctor.